When it comes to any chronic disease, understanding the symptoms is vital. But when it comes to asthma, that means being able to recognize the difference between a typical allergy attack and a more severe attack, and being able to identify the proper medication to take in each case. Asthma symptoms can be difficult to distinguish from other common illnesses or allergies. If left untreated, asthma is one of the leading causes of emergency room visits and hospital admissions. But there are effective ways to treat asthma. This guide will help you understand the basic symptoms of asthma, how it affects the body, and how you can make treatment decisions. What is asthma? Asthma is a condition that affects the lungs. Symptoms of asthma include wheezing, chest tightness, and shortness of breath. Asthma can be caused by environmental triggers such as smoke, pollen, or pet dander, or by health conditions such as sinus infections. Some people may only have asthma symptoms during an asthma attack, while others may experience symptoms all the time. There is no cure for asthma, but there are treatments that can help control symptoms. Asthma affects nearly 21 million children and adults in the United States. Over a quarter of all children under 18 years old are currently living with asthma, and 3.2 million people have had a life-threatening asthma attack. Asthma is a disease of the airways. The lungs' air passages are made up of two types of tissue, one called airway smooth muscle, ASM, and another called airway epithelium. ASM is a tightly wound, spindle-shaped muscle that forms the walls of the airways. ASM contracts and relaxes quickly and easily. When it contracts in response to a trigger, such as an allergen, it blocks airflow. This results in a tightening of the airway, which is called an asthma attack. ASM is normally very responsive to asthma triggers, but over time it becomes less sensitive. This can make symptoms worse. ASM also contracts when it is overstimulated, for example, if there are too many allergens in the air. This can lead to airway narrowing, achieving asthma, and worsening asthma symptoms. How does asthma affect you? Asthma can affect anyone, anytime. If your child has asthma, it's not just their lungs that are affected, but their health and well-being. Because asthma is a chronic illness that requires lifelong management, it affects the whole family, including children, teenagers, and adults. But, if you're not familiar with what asthma is, and how it affects your life, you may not realize how important it is to get asthma under control. Some of the physiological and psychological effects of asthma are as follows. Fatigue, often without adequate sleep. Fatigue is a common symptom that can be caused by many things, such as illness, stress, or lack of sleep. For people with asthma, fatigue may be caused by the disease itself or by the treatments used to control asthma symptoms. A cough that is often a combination of runny nose and postnasal drip. A cough that is often a combination of runny nose and postnasal drip is called rhinorrhea. It is caused by the common cold, the flu, or allergies. These conditions can irritate and inflame the lining of your nose and throat, triggering a cough. Other causes of rhinorrhea include smoke, pollution, and strong odors. Uncontrollable sneezing. Sneezing is the body's way of getting rid of irritants in the nose. Sneezing can be caused by allergies, a cold, or a sinus infection. But for some people, sneezing can be hard to control. This is called uncontrollable sneezing. Shortness of breath. Shortness of breath, medically termed dyspnea, is a common symptom that can have many causes. For people with asthma, shortness of breath is often a sign that an attack is occurring. Understanding the triggers and symptoms of asthma attacks can help you manage your asthma and avoid shortness of breath. Chest tightness and pain. Chest tightness and pain can be symptoms of a number of medical conditions, including asthma. Asthma is a respiratory condition that affects an estimated 25 million Americans. The hallmark symptom of asthma is wheezing, but chest tightness and pain can also be indicative of the disorder. If you are experiencing chest tightness and pain, see your doctor to determine the cause and receive treatment if necessary. Common causes of asthma. Asthma is a common respiratory illness that affects people of all ages. The cause of asthma is not fully understood, but there are several known risk factors. Some of the most common causes of asthma are as below. Allergies can cause asthma. Did you know that allergies are the most common cause of asthma? In fact, about 90% of people with asthma also have allergies. This is because the body's immune system overreacts to certain allergens, which can lead to inflammation and narrowing of the airways. Allergens can include things like pet dander, pollen, and dust mites. Viral infections can cause asthma. Asthma is a common lung disease that can cause difficulty breathing. Viral infections are one of the most common causes of asthma. The viruses that most commonly cause asthma are the respiratory syncytial virus, RSV, and rhinovirus, the virus that causes the common cold. Other viruses that can cause asthma include influenza, the flu, adenovirus, and coronavirus. Exposure to smoke, air pollution, or fumes can cause asthma. Asthma can be caused by a number of things. One of the most common causes is exposure to smoke, air pollution, or fumes. People who have asthma and smoke are at a higher risk of developing asthma. Physical triggers can cause asthma. The cause of asthma is unknown, but physical triggers can cause an asthma attack. Some of the most common causes of asthma include allergens, smoke, air pollution, and cold weather. Mental triggers can cause asthma. One of the most common causes of asthma is mental stress. If you are feeling stressed, take a moment to breathe deeply and relax. The next time you feel stressed, go outside for a walk. Walk slowly and don't rush back indoors. If you have asthma, it is important that you manage your stress. Environmental allergens can cause asthma. Asthma can be caused by many things, including environmental allergens, such as pollen, dust mites, and pet dander. But a new study suggests that the bacteria living in your gut might play an important role too. Researchers have known for some time that the gut microbiome has a major influence on asthma and allergies. Certain medications can cause asthma. One common cause of asthma is certain medications. Medications that can cause asthma include aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, beta blockers, and sulfa antibiotics. Family history can cause asthma. Asthma is a common lung disease that affects people of all ages. The cause of asthma is unknown, but it is believed to be due to a combination of environmental and genetic factors. Studies have shown that family history can play a role in the development of asthma. Pregnancy can cause asthma. Pregnancy can lead to certain changes in the body that increase the risk for asthma. Pregnancy in itself does not increase the risk for asthma. However, a pregnant woman may be more likely to develop asthma if she has other risk factors such as living in an urban area, having other health conditions, or exposure to certain chemicals. How to diagnose asthma? A doctor can diagnose asthma by taking a medical history and performing a physical exam. He or she may also order tests, such as a chest X-ray or spirometry, to help determine the best treatment plan. Diagnosing asthma can be difficult because its symptoms are similar to those of other respiratory diseases. However, there are several methods that can be used to help identify asthma. Some asthma diagnosis methods are more accurate than others. Most doctors use a combination of methods to arrive at a diagnosis. For example, if a doctor suspects asthma based on the patient's symptoms and medical history, but test results show that the patient does not have asthma, the doctor may still consider the possibility of asthma. A chest X-ray is the most common test used to diagnose asthma. The X-ray will show if there are any lung changes associated with asthma. A chest X-ray is a good test to use if you do not have asthma. But, if you have respiratory symptoms such as wheezing, coughing, or shortness of breath, then your doctor may recommend other tests to help identify asthma. What are the 5 most common types of asthma? Asthma is a common lung disease that affects millions of people in the United States. There are 5 types of asthma that are the most common. Each type has different symptoms and requires different treatment. Knowing which type of asthma you have is important in order to get the right treatment. The 5 most common types of asthma are: acute bronchial asthma, caused by an allergic reaction to inhaled irritants, such as pollen. Exacerbation, the worst asthma attack that is worse than usual. Chronic asthma, when a person experiences repeated symptoms and attacks throughout their life. Status asthmaticus, an acute, life-threatening attack of asthma. Unresponsive asthma, when an individual has a history of chronic and severe asthma, but no symptoms. Common asthma triggers and how to avoid them. Some common triggers of asthma include smoke, dust, pollen, and pet dander. There are a number of ways to avoid these triggers, including staying indoors on high pollen days, using air filters, and keeping pets out of the house. Although asthma is a chronic condition, it can be managed effectively with regular visits to the doctor, medication, and proper inhaler use. Asthma is one of the most common chronic conditions in the world today. Some of the triggers are well known, such as smoking and exposure to mold. Others are less so: stress, lack of sleep, depression, family history of asthma or allergies, and even the weather. A new study published in the Journal of Allergy and Clinical Immunology found that people who are exposed to high levels of carbon dioxide, CO2, for long periods of time may be at a higher risk for asthma. There are a few ways to avoid asthma triggers. With some, the best solution is to avoid them. Avoiding these triggers will reduce your chances of asthma attacks. Avoid smoking. Smoking increases your risk of developing asthma by as much as 80%. Maintain a healthy weight. Avoid air pollution. Maintain a healthy diet. Avoid allergens. Allergens can trigger asthma symptoms and are difficult to avoid entirely. However, it is possible to reduce the severity of an allergic reaction by avoiding them. Avoid irritants. Irritants such as smoke, dust, and pollution can trigger asthma attacks. Avoid being overexposed to high levels of carbon dioxide. Avoid being overexposed to low levels of oxygen. Avoid being overexposed to ozone. Avoid being overexposed to nitrogen dioxide. Avoid being overexposed to sulfur dioxide. Take care of your lungs. Take care of your lungs and avoid smoking, tobacco smoke, air pollution, and irritants. How to treat asthma. Asthma can be mild or severe, and it can occur at any age. While there is no cure for asthma, there are many treatments available to help control the symptoms. Treatments for asthma include medications, such as inhalers and steroids, and lifestyle changes, such as quitting smoking and avoiding triggers. Asthma is a chronic disease that can be controlled with proper treatment and lifestyle changes. Asthma is not a fatal disease, but it can be serious if left untreated. Asthma can be treated by avoiding triggers in your environment. Avoiding cigarette smoke, dust, pollen, and mold will help reduce your symptoms. Also, make sure that you get enough rest and exercise. Make an effort to maintain a healthy diet. Keep your airways open and make sure that you take your medication on time. Asthma is a chronic condition that can be treated if caught early enough. It is important to seek immediate medical attention if you notice any symptoms of this disease, including wheezing, shortness of breath, chest tightness, or cough. It is important to stay out of the sun and avoid secondhand smoke, dust, pollen, and other substances that cause the symptoms of asthma. Medications, such as inhalers and steroids, can also be used to treat the symptoms of asthma. If you want to live a normal life, it's important to quit smoking and other harmful habits. In case you still feel that you need more help, see your doctor. It's not something that should be ignored. What are the types of asthma medication? There are many different types of asthma medication, which can be divided into two categories: quick relief medications and long-term control medications. The type of medication that is prescribed will depend on the severity of asthma and on the individual's symptoms. The following are the most common types of medications used for asthma. Quick relief medications, inhalers, which are often called puffer devices and include metered dose inhalers, MDIs, dry powder inhalers, DPIs, and nebulizers. Long-term control medications, corticosteroids, leukotriene modifiers, beta-2 agonists, and anti-inflammatory agents. Although asthma can be managed effectively with a combination of medication and lifestyle changes, the most effective treatment regimen for asthma is usually the regular use of long-term control medications. In the United States, about 12% of children and 4% of adults have asthma. About 4 million Americans have asthma attacks each year, which causes 100,000 emergency room visits and 500 deaths. What can you do to control and prevent an asthma attack? Some people with asthma only have mild symptoms, while others have more severe symptoms that can make it hard to do everyday activities. An asthma attack is a sudden worsening of your asthma symptoms. There are many things you can do to control and prevent an asthma attack. You will need to see your doctor if you have an asthma attack or wheezing. Your doctor can start you on a treatment plan that is best for you. You may be prescribed Ventolin, which is a medicine commonly used to treat asthma. Also, you can be prescribed an inhaler. During an asthma attack, you may need to use your Ventolin or inhaler more often than usual. Your doctor may also tell you to use your Ventolin or inhaler as needed to prevent attacks. You can prevent asthma attacks by making sure you get enough sleep, keeping your blood pressure and cholesterol levels in check, eating a healthy diet, getting regular exercise, and stopping smoking. If you think you may have asthma, talk to your doctor about getting a proper diagnosis. How to use an inhaler. Inhalers are devices that help you breathe in medication to treat asthma, bronchitis, and other respiratory conditions. Inhalers come in two types: metered dose inhalers, MDIs, and dry powder inhalers, DPIs. DPIs are becoming more popular than MDIs because they are easier to use. When using an inhaler, follow these steps. Step 1. Remove the cap from the inhaler. Some inhalers have a small plastic cap that you can remove by pressing on them. Step 2. Place the inhaler over your mouth. Step 3. Breathe deeply through your nose. But do not hold the inhaler too tightly. Place the mouthpiece to the back of your throat and breathe out through your mouth. Step 4. Repeat steps 1 to 3. Step 5. When you finish using the inhaler, clean it and replace the cap. How to live with asthma. Living with asthma is not an easy thing. While there is no cure for asthma, there are many ways to manage the condition and live a full life. Here are some tips on how to live with asthma. Be aware of your symptoms, take your medication as prescribed. Be sure to use the proper inhalers for your condition. Get regular checkups with your asthma specialist. Learn how to properly manage asthma attacks and when you may need emergency care. Get support from friends and family. Take it easy on yourself, but don't let asthma stop you from enjoying life. Be active. You can still do the things you like to do, even if your asthma is making it difficult for you to breathe. In conclusion, asthma is a serious medical condition that should be monitored and treated by a doctor. Understanding the symptoms and treatments is essential for managing asthma. There are many different ways to treat asthma, so finding the right treatment plan is important. There are also many different types of asthma, so it is important to find out which type you have. With the right treatment plan and management techniques, asthma can be controlled and life can be enjoyed.